Philip, good morning, and thank you for your willingness to be interviewed for the Healthcare Innovation Labs newsletter and website. Would you take a moment and introduce yourself and your role within WashU School of Medicine?
Sure, happy to be here. I have a couple different roles. I think most relevant to this interview is that I'm the Associate Dean and Chief Data Scientist for the School of Medicine, which is a role where I try to oversee a strategic approach to data and analytics as well as artificial intelligence for the medical school and really in all three mission areas, so education, research, and clinical care. I also have my own research laboratory and I lead our Institute for Informatics, Data Science, and Biostatistics, which is our academic home for people working in those areas.
That's fantastic. And just given that role or roles that you play within the school, maybe if you could give us a sense of what is your perspective on AI in the healthcare industry today?
Yeah, so it's interesting. I probably will give an answer that's different than what you might expect, because I know that everyone is very excited about the role of AI in healthcare, and in many ways that excitement is connected with a perception that it's very new, and that we're still trying to figure out where and when and how we should use it. The reality is that AI has been around in healthcare since the 1960s. It's actually the origins of the academic field that I'm in, informatics. And it's really that today, with this confluence of computational capability and awareness, that we've finally reached a point at which the promise of AI, I think, is very accessible to most people in the healthcare industry. So we've reached a really important tipping point, where I think now more than ever, people can understand how AI might change patient experience, provider experience, quality, safety, outcomes, value, research, education. I could keep on giving a lengthy list, but that's really a function of awareness more than it being a new technology. And that's both good and bad, right? So the good part of that is, of course, that awareness comes with a lot of expectations, and that drives us to innovate and deploy these technologies. Perhaps the negative is the perception of newness would lead us to not learn from prior history if we're not careful about sort of looking at what's been done previously and just assuming that this is something that's brand new.
So with that idea that this is not something that's necessarily brand new, and we've had exposure, we've had experience with AI in the past, where do you see health systems should be focused on their AI journey today, and how should they start engaging AI further?
Yeah. So I kind of think of it, I'm a visual thinker, so I think of it like a swim lane. So there's one swim lane, which is potential applications of AI, that probably are technically feasible, but will not substantially change health or healthcare. And these could be, workflow automation or even prediction tasks that may not actually improve upon human workflow that already exists. So that's sort of a lower bound where if we sort of spend our time and energy working in those types of problems, we probably won't see the impact that we want. And then there's this upper bound, which is areas where we're not really clear on what the implications of using AI really are. A great example are closed loop systems where we might use AI and allow it to make a decision and then actually implement that decision. Could be as something as simple as an IV pump or something as complex as a robot in an operating room. And there, I think the technology is not quite ready for us to sort of relinquish the human in the middle dynamic of healthcare. And so that's an example of going too far. So when we think about where we should be engaging, we want to find that swim lane that's in the middle. We don't want to be operating at too low a level where we don't see the impact that we want, but we don't want to be operating at too high of a level where we perhaps have unintended consequences of deploying AI. And so in that middle swim lane today, I think there's some really interesting things that we can do. There are tasks that we have humans engaged in that are largely around information capture and summarization, that are central to the practice of medicine, but are not the best use of time and sort of cognitive energy on the part of providers or patients. So think about documentation in the exam room or at the bedside, or the summarization of a patient's medical records so that appropriate decisions can be made based on that patient's history. I think patient experience is another area much like that, where we can think about how do we make it easier for our patients to interact with the healthcare system when they want to get to a solution, whether that be talking to a provider or scheduling an appointment or getting their medication refilled. And there's also opportunities in the research arena where we could think about how do we do a better job of asking and answering all the questions about the data that we already have, rather than trying to generate more data. Can we look at all the available knowledge that's out there and say, here's the full spectrum of questions we could ask about that data? Those are things that I think we can do today that improve healthcare delivery by making it such that humans are operating in the space that only humans can operate. For example, interacting in the exam or at the bedside without a computer in between them, or helping our patients to have an easier, less sort of difficult time navigating the complex healthcare system, or making research faster and better. Those are things we can do today, but I'd emphasize all of them involve augmenting human capabilities. And that's, I think, the most important takeaway. That AI today is not about replacing humans, it's about making humans better and allowing humans to do the things that humans are uniquely able to do in the healthcare system, and sort of stripping away a lot of the activity that maybe doesn't take advantage of those human cognitive strengths.
I think that's so important for us to remember and ground ourselves in, is that when we speak about AI, we're not talking about replacing the human element. It's more that that complement to those characteristics that are so human to us, that are essential as we're delivering care. With that in mind, though, what risks would you say that we need to be aware of as we start to engage AI in our healthcare systems?
There's probably three big areas of risk, and I'm certain this is not an exhaustive list, because this is still very much an emerging area as we think about some of the new applications available to us. The first risk has to do with how we build the AI, because intrinsically AI is as good as the data that we have to train the algorithms or the tools, and more importantly, the labels we put on that data. So for example, if I want to build a predictive algorithm that tells me which patients are at risk of developing sepsis in the hospital, I have to train that algorithm using data from historical patient encounters. And ideally, I would be able to tell the algorithm which of those patients actually had sepsis and which did not. But I think we all know in healthcare that diagnostic reasoning is not quite as easy as it may sound at a surface level. So what is that ground truth? How do we know truly which patients had sepsis and which did not? Is that a human reading the charts and saying yes or no? Is it based on billing codes? Is it based on something else? So that labeling of adequate amounts of data and labeling it in a way that's highly accurate is a big risk, because if it's not, then we have a potential that we will produce an algorithm that does not actually generate the results we want. And very closely tracking with that is the issue of bias, because depending on which patients or environments or providers or situations that we use to collect that data, we may be building algorithms that fundamentally reinforce structural or other pre-existing biases in the healthcare system, at the risk of therefore providing less than optimal care for all patients that interact with health or healthcare services. So I think we have to be very cognizant about what's the data we use, how is it labeled, and what are the potential sources of bias. And I always say to people, when we talk about bias, we will never eliminate bias in the data we have. But at a minimum, we need to be able to measure it so we know what the problem is, because you can't solve a problem if you can't measure it. So that's one big bucket. I think the second big area of concern is how do we navigate what we call in the informatics world the intermediate effect, which is that every time we introduce a new technology, the performance of humans who are interacting with that technology tends to decline before it gets better. And that's because technology has a tendency to sort of rewire the way we think about a problem domain. So if I introduce a new AI tool and it changes the way you consume or reason on data at the point of care or in the population health setting or any other context, you're probably going to perform at a lower level before you get to that sort of ideal, sort of improved level of accuracy, quality, safety, whatever your outcome is. And there's a real risk of not planning for and supporting human beings as they navigate that intermediate effect. And often people refer to it somewhat jokingly as the trough of despair. That's usually where you introduce a new piece of technology and then everyone says, why is everything worse? I thought this technology was going to make things better. And that usually happens before things get better. So how do we navigate that? And how do we make sure we navigate in a way that supports the humans interacting with the technology, doesn't put our patients at risk, and frankly is financially viable. And that's, I think, something that historically we've not done well in healthcare, planning for that intermediate effect. And then I think the third part is, or risk, is trustworthiness. I fear that much like other areas of sort of public dialogue around health and healthcare, there are going to be significant concerns about the use of AI in healthcare that will not necessarily be based on factual information, but rather conjecture or opinion or incomplete information. And that could lead people to not trust these technologies before we've had a chance to actually prove their viability, their impact. And so therefore, I think this concept of AI literacy, and AI literacy not just for experts, but for people that are going to interact with AI every day, is going to be really, really critical. And we all interact with AI every day already. Like when you think about the voice assistants you use, or even something as simple as if you use Grammarly when you're writing to help you with, say, spelling and grammar and conciseness. I know I do. And we're interacting with those technologies without even knowing that we're doing that. So I think AI literacy is a huge issue. So in sum total, big buckets: bias in sourcing of data to train the algorithms, understanding the human impact of deploying these new technologies, and then sort of dealing with trustworthiness and sort of AI literacy. I think those are going to be the big challenges in front of us. What I didn't talk about, of course, is some of the things that you see in the literature, such as people worrying about hallucinations from generative AI, where we produce patently incorrect or false conclusions. And I'll just say that, yes, that's a real problem, but that is just a reflection of the knowledge that we as humans have produced and are being used to train the algorithm. So I would kind of put that in that first bucket of sort of worrying about the data we use to train these algorithms.
That's very helpful, very insightful. As we round out our time here, Philip, I want to just get your perspective on the future landscape of AI in healthcare.
Yeah, so I think much like the opportunity spaces that I talked about earlier, I think the future landscape is going to see us moving back towards a model of healthcare that's much more humanistic, where computers and technology get out of the middle of the interaction between humans in the healthcare system and become more the supporting entities that they're meant to be. So I am very anxious to see an environment where when you go into an ambulatory setting or into a patient's room, you don't see a computer physically sitting between the patient and the provider, but rather that there's that humanistic interaction. And in the background, we're capturing all that data that we need to provide superior care, to improve quality, safety, value, and outcomes. And so I think the first big change that we're going to see is sort of computing is going to become more ambient and less sort of front and center in the healthcare setting. I think the second area that is going to be really interesting is I think we are going to be in a position where we will be able to make decisions that take advantage of human capabilities, but that allow us to sort of touch all of the data that's out there, or all of the knowledge. So what am I saying? Rather than us sort of Googling or looking at journals or engaging in sort of exhaustive sort of information-seeking behaviors, what if researchers, educators, or practitioners or patients simply could have a meaningful summary of all the high-quality domain knowledge that they need to ask and answer a question in front of them right now? So I think we can take information seeking out of the mix and make that something that is easy and consistent and systematic. And again, allow humans to use those cognitive strengths in pattern recognition and fuzzy reasoning and things like that. And then I think the third area, which is going to be really interesting, is going to be consumerism in healthcare. Are we finally going to be in a position where patients are not just receiving healthcare, but are active parts of the healthcare system because there are ways for them to interact in a meaningful way, whether that be promoting their own health, interacting with the system to schedule their encounters, understanding and acting on their test results, participating in shared decision-making with their providers, again, mediated by AI, so those encounters can happen where and when they make the most sense for our patients. So to me, that's a really exciting future point. And underpinning all of that is going to be an amazing renaissance in research that's going to use all of this data that we collect every day that's largely untapped, because we'll be able to summarize it, we'll be able to act upon it, and we'll be able to deliver those insights in the right time, place, and format. But again, it's going to require us to be very intentional in thinking about how we deal with the human factors that sort of surround us. And that's my final comment I want to make. I don't think this future of AI-enabled healthcare is really a technical endeavor. I think it is a workflow and human factors and sort of humanistic endeavor, and the technology will follow. And so as long as we understand that it's not an engineering problem, but rather that it's a human opportunity, I think we'll get to that sort of brave new world where information is more free flowing.
That's fantastic. You've certainly excited me for the future of AI in healthcare and appreciate your optimism for that. So, Dr. Philip Payne, thank you so much for your time, and we look forward to hearing more from you as we advance our knowledge in AI in healthcare.